So I'm bringing management of the NHS back into democratic control by abolishing the arm's-length body NHS England.
Welcome to WatchMojoUK, and today we're checking in with Keir Starmer and the current Labour government and seeing whether they're trying to tear the NHS apart.
I want to see far more devolution, power, responsibility.
Before we begin, we publish new content every day, so be sure to subscribe to our channel and ring the bell to get notified about our latest videos. On the 13th of March, outrageous headlines broke that Keir Starmer was going to be scrapping NHS England.
Today's challenges are part of a much wider reform agenda that's about going further and faster.
Now, don't panic immediately, because this doesn't mean that he's going to be destroying the NHS. Not yet anyway, though there are many other worrying pieces of Labour policy incoming.
Since coming into office, this government has made big strides in fixing our broken NHS.
This particular policy is designed to take the NHS back in time to before the Tories began annihilating it under David Cameron. NHS England specifically is an executive oversight body designed to organise the budget of the NHS to try and make it more efficient.
We inherited an NHS going through the worst crisis in its history, so there is no time to waste.
Has that worked in the last 13 years? Well, no, absolutely not. The NHS has only gotten worse since the Tories took control in 2010, but equally hasn't gotten any better so far since Labour's landslide election victory.
Well, today, Madam Deputy Speaker, we are putting the final nail in the coffin of the Conservatives' disastrous top-down reorganisation of the NHS.
So why is Starmer doing this? Well, he says that NHS England is a redundant organisation and that most of its duties are also being performed by the Department of Health and Social Care within the government. By abolishing NHS England, the NHS comes back under direct government control, managed by the DHSC.
Work has already begun to strip out the duplication between the two organisations and bring many of NHS England's functions into the department.
Starmer and Health Secretary Wes Streeting think this is going to be an ideal way to save money without affecting the way the NHS actually functions for the public, eliminating layers of red tape and cutting out the middleman.
Today, the NHS delivers worse care for patients, but is more expensive than ever before.
But the key question now is, will this have unforeseen effects? Well, from the start, it's going to lead to thousands of job cuts, at least 9,000, but NHS England currently employs 15,000 people.
You're going to sack, 9,000 or so civil servants or NHS England employees.
Because of these monumental job losses, as you can imagine, the trade unions aren't happy. Unison is the union primarily for public sector workers, with many of those in administrative roles at NHS England coming under their remit. Unison hasn't necessarily criticised the government's decision to do this, but has criticised the way Labour has gone about it, with Christina McAnea, the General Secretary, saying, quote, "Just days ago, they learned their numbers were to be slashed by half. Now they discover their employer will cease to exist." End quote.
Now, tough choices won't just stop there. In this era, they will keep on coming.
It can't be avoided, though, that the NHS was better before NHS England's creation in the first years of Conservative rule, though it's clearly hypocritical for a Labour Party so insistent on getting people back to work to then destroy an entire organisation and cut over 10,000 jobs.
We've currently effectively got two head offices for the NHS. NHS England, the Department of Health and Social Care, taken together, 19,000 people working for two head offices.
We've no idea right now how much support those NHS England workers will get. Will some of them migrate to the Department of Health and Social Care or back into the NHS proper? Or will they be left with such a bad taste in their mouths that they leave the public sector behind entirely?
But we will be treating people with care and respect and the fairness that they are owed through this process.
Another concern is Wes Streeting himself, who's advocated for the NHS increasing its use of private healthcare, including using NHS money to pay for patients to be treated privately so that they can be treated faster.
Yeah, I didn't anticipate coming in wanting to make this change to NHS England. It wasn't on my list of priorities.
Streeting's track record and presence as Health Secretary alone has set alarm bells ringing.
Because I don't see why decisions about £200 billion of taxpayer money on something as fundamental to our security as the NHS should be taken by an arm's-length body, NHS England.
Equally, anyone who's been paying attention to the NHS for the last 15 years, which is everybody in the UK, knows that NHS England's existence isn't really the big problem with the NHS. The big problem is, simply enough, that it's not getting enough money from the government. Scrapping NHS England will free up some cash, hopefully, but will it be enough to give the NHS the investment it desperately needs?
So today I can announce we're going to cut bureaucracy across the state, focus government on the priorities of working people, shift money to the front line.
NHS waiting times are only getting longer, particularly for cancer care, seen by many as the key indicator overall of whether the NHS is meeting its other diagnostic and treatment targets.
When the Tories were in power, they inherited the shortest waiting times and the highest patient satisfaction in history, and then they turned it on its head.
After decades of being able to rely on the NHS, people are now living their lives even more terrified of developing cancer, in case the NHS fails and they can't get it diagnosed or treated in time. But this isn't the only big Labour announcement of the week. In all the chaos about NHS England, not as many eyes have been on announcements to cut the number of people on benefits, notably Personal Independence Payments, or PIP.
Donna fears cuts to personal independence payments that help with the cost of disabilities.
Starmer wants to cut £5 billion from disability payments in an effort to force people back into work. But there's very real evidence that the country is getting sicker, perhaps because it's now so difficult to get NHS treatments for anything but the most serious, life-threatening problems.
David's wife has dementia, and so they get benefits for those too unwell to work.
She might need live-in care at some stage, and that's just a tremendous drain.
Labour is supposedly planning to freeze PIP, with a recent report commissioned under the Tories suggesting that PIP should be almost impossible to get for those aged 16 to 30, as if nobody in their 20s has a long-term condition that means they need some extra financial support.
Now ITV News can reveal the details of welfare cuts of more than £6 billion a year. £5 billion will come from making it harder to qualify for those personal independence payments.
As well as that, many people on PIP do work. Working doesn't change their eligibility for the benefits because it's not means tested. Elsewhere though, and universal credit, which is means tested, is also under fire. Labour wants to cut the amount of people claiming universal credit are eligible for, unless you're already employed and claiming UC, in which case you'll be entitled to more money.
Meanwhile, those on universal credit who are actively looking for a job will see their payments rise, but there will be a significant cut for those judged too ill or disabled to work.
All of this is working on the assumption that every Brit claiming universal credit who isn't in work can work, but is choosing not to, which just isn't true.
The Work and Pensions Secretary Liz Kendall says the system is broken and must be changed to encourage work. But disability charities like Scope say PIP is not linked to work.
With the NHS floundering, the number of people on long-term sick leave or with disabilities is only rising, and trying to force those people into work by boosting funding for job seekers isn't going to help them. Why not put that money into the NHS so that they can get the care and support they need?
It was actually too much, as you mentioned, for the Conservative government to go after personal independence payments.
The government's also inexplicably claimed that it's too easy to claim PIP, while any disabled person will disagree.
Carol Vickers, who has multiple disabilities and requires an assistance dog, once told me how she found the process to get the benefit traumatising.
To claim PIP, you also have to fill in a 50-page document telling DWP decision makers who aren't actually medically trained and often ignore the medical evidence provided by doctors on PIP claims just how disabled you are, often in excruciating detail.
She says that PIP allows her to work a full and part-time job, adding that the problem is often employers who refuse to hire disabled people.
It's the untrained people at the DWP who did such egregious things under the Tories as declaring one man, Stephen Smith, who was so ill from pneumonia he only weighed 6 stone, fit for work. He passed away a few months later.
I think that there are millions of disabled people who are either in work or who want to work, and the barrier is not necessarily them.
All of these policies have, unsurprisingly, stirred up rebellion in the Labour backbenches, though it looks like currently Starmer is going to whip MPs to vote for the cuts in what's being deemed a loyalty test.
The Prime Minister is reportedly facing his biggest rebellion yet in Parliament since stepping into number 10.
It's difficult to see who the new Labour policies are truly designed to help.
Campaigners say the changes will push disabled people further into poverty. The government, though, says it has a moral duty to get Britain working again.
They're claiming that these cuts are going to help people save money on taxes, but various taxes, including council tax, are rising yet again. In the run-up to the 2024 election, Starmer dodged the question about whether he was going to raise taxes every single time, and still seems to be doing it. There was also nothing in Labour's infamously vague manifesto about abolishing NHS England, just platitudes about someone adding tens of thousands of GP appointments and slashing waiting lists, with no real plan of how the party was going to do this.
And I don't disagree that we do need to reform the system. I agree, but not like this. Not at the expense of disabled people.
The manifesto does, however, make claims about getting people back into work, insisting that, quote, "There will be consequences for those who do not fulfill their obligations," unquote. There certainly will be, Keir, and perhaps you should start with Parliament, since some MPs in the House of Commons barely turn up.
They had already set the system up to fail before the pandemic. That was the problem. What we're doing is fixing it.
Let us know in the comments what you think of Keir Starmer's Labour. Are they a repeat of Tony Blair like they want to be, or are they just red Tories, doing just as much damage to public services as the Conservatives?
Driving change forward with a plan for change, focused on the interests of working people.